So the next one is going to be IRM. Don't call it like I did when I first got to the clinic, and all the doctors were laughing. So it's IRM. Okay, 1 scoop again. This is just me because the consistency has to be right, and sometimes it's a little too wet. I'll put a little bit over there, just like that. Okay.
Notice she's mixed twice with these instruments, and they're nice, and they can be used again. It's so annoying when my assistant pulls out it's a sterile instrument, and see it has globs of old cement or IRM or PTAC on it, or Vitribond on it. So can't emphasize that one enough. Make sure you clean it off.
So this one I put like 1, 2 drops. This one you kind of have to play with a little bit. Okay, and then I'm going to mix. Going to bring it towards each other. You don't want this one to be, this one should be almost like a, kind of like a Play-Doh. Not dry and crumbly, but not sticky either. You should be able to roll it up in your fingers, and if you look at it, it's shiny, and you want to take some of that shine away from it.
You look at it right now and you think, oh wow, this is very crumbly and dry. But if you were to put that in a ball, it'd still be too moist.
Okay, and this one comes in the capsule, which is easier for a lot of people. I like to do it this way. I just always have to remind myself, okay, my doctor's waiting for me. Okay? And I would probably say that this one's still a little sticky. That's why I like to put some on the side there, and I kind of roll it in there. And play with it a little bit.
This material is used, they use it a lot back in pedo. Sometimes endodontists will use it a lot. It's a temporary material. And it's a material I think it's one of the more difficult to mix to get the right consistency in.
So I would give him. And if your doctor's like this, that he's not ready, keep playing with it. It just keeps it. It keeps it right. So we lost your gloves?
Yeah.
Are they up in the front? So at this point, my doctor's not ready, and we need to, because kid's messing around. So I'm hoping he hurries up so that I don't have to mix it again. And it does happen.
I can take a little chunk if I want, or I can take a big chunk.
It's getting sticky now.
Yeah, it's getting sticky. Now this material, it's not light cured, it just sets up with time. And that's why she needs to have it nice and if it's too wet, it takes forever to set up. And they'll use this frequently on kids, or you'll use it after you've started a root canal on a patient and they've already been in the chair for an incredibly long time. And they're just like, oh, let me get out of here. So you want it to be ready to go. Sometimes once I am putting this in, I'll ask for a little bit of additional powder that she'll put some on her glove, and I can just use it when I'm kind of putting this into place, because it does get sticky, so I can kind of tap it into place. Without that powder on there, without the IRM powder on there, it'll stick to my instrument and pull back with it and pull out. Okay?
And then while he's doing that too, sometimes I'll have a 2x2 and then clean off that end, and he'll get more off of my finger, and then you just keep cleaning it off.
The biggest issue you guys are going to have with this one is making it too runny, too wet. So like she did, put the extra powder up to the side and keep it nice and dry. Or make it so you can make it nice and dry.
Okay.
Okay.
Now that was my own personal choice to do the IRM that way. It's going to depend on your doctor as well. They have, no, I'm thinking, they do have IRM, in the capsules also. Okay, and then you don't have to mix it that way, which I think most assistants do the capsule. Okay.
And